So before we move to the next startup, and that will be MedRep Group, so you can slowly get ready to share the screen. I'll just have two more additional points. So one is that I forgot to mention is in general house rules. It is really good to put your name / organization you are coming from, so also other people on the call can see who is speaking, who is asking questions, who is representing. So all pitchers, jury members, just put your name / organization you're coming from, so it's kind of transparent. And the second point, thank you and shout out for Western Balkan Fund and EBRD, who joined us as partners on this event and actually helped us to build the technology and the environment to host this amazing virtual expo. So again, thank you guys for joining us and for believing in us in doing something that hasn't been done in this format before. Yeah,
a great pleasure.
Thank you, Dan. That being said, Vladimir, MedRep, floor is yours. So once you're ready, just give us a mark and we'll start the countdown.
Okay, here is the mark, and I am Vladimir, as you said, and I run MedRep, which is a closed platform that connects pharma companies and healthcare professionals, incentivizing collaboration across the entire value chain. Being in pharma marketing and sales sector for more than 20 years enabled me and my team to create a SaaS solution that streamlines information and management in every stage of promotion and education for medicines, medical devices, and over-the-counter medications. With MedRep, the key players in the pharma industry interact with each other while avoiding common ethical and legal obstacles in pharma products marketing. This is how we see the pharma marketing future, and here are some general core product features providing solutions for everyday problems that healthcare professionals and pharma sales and marketing teams have. For example, MedRep provides answers to everyday questions that healthcare professionals can have for any product. MedRep enables continuous medical education via a proven e-learning system. Also, the one-click prescription and sent direct to patients with a unique code generation for security and information protection, and a lot more features. We work in the ever-growing pharma market sector with huge marketing budgets that only in the 5 largest European markets exceed $20 billion annually. The product that we created is ready, but we require resources for enlargement, financial resources, of course. The key difference is the business model that MedRep provides, where pharma companies cover all the expenses for the use of all user types that are on MedRep on the market where it is launched, which is much different from our competitors. On the other hand, independent studies and market analysis show that some of the features that our competitors provide are not a sufficient motivator per se for a healthcare professional to use an e-prescription platform. Only MedRep offers incentive programs for healthcare professionals to convince them to use the new communication tools. We launched MedRep on Macedonian market only to test and provide traction, but we have been already approached by regional pharma companies to launch on surrounding markets too. That is why, based on the business model, we created the revenue projection for regional markets such as the one that you see for the Serbian market. The new market strategy is ready and tested too. That is why today and in the past month, we are pitching for investors that will support us with $300,000 to launch on at least 3 new markets that will increase our turnover to more than 3 million in the next 24 months. As a recognition that we are on the right track are the rewards that we have been winning in the past 6 months. The Macedonian Fund for Technology and Innovation Development, they rewarded us for the digital tools and solutions to fight COVID-19. The chambers nominated us and two more companies for the Digital Innovation Award on WITSA in Malaysia this year, which is probably going to be a virtual event. And the last is from last week. We were the number one number one voted company at the Artificial Intelligence Tech Summit in New York. It was virtual, of course, but they call it from New York. The last but not least important is the ecological impact that MedRep enables, shown through a study from the University of Warwick, concluding that allowing 1,000 employees to work from home just 2 days per week would reduce CO2 generated by staff commuting by 40%, which is very good for the environment. MedRep is more than just a software. As a pharma company member to a MedRep platform, they can tap into an expansive network of doctors and pharmacies, and information technology will help them achieve an exceptional end-to-end information delivery. And because they're all part of one platform, the customer base will never become fragmented. Thank you very much for this opportunity. I apologize for the 30 seconds extra. I tried to do my best.
Thank you, Vladimir. It was only 10 seconds, so how would you say? In error space, which is fine. Jury, floor is yours.
I'm yours too.
I would like to hear more about the acceptance rate of the doctors.
I'm kindly asking for a louder, if you can speak out louder, because I cannot hear anything.
Can you hear me now?
Yes, it's much better.
What would be the acceptance rate in Macedonia of this solution up so far? Because the doctors and the pharmacies are the key acceptance.
Okay. I have been asked this question in the past 6 months for 600 times. So at the beginning, it depends on various, I don't know, age of the healthcare professional or the approach of the pharma company that wants to enter into, let's call it a marketplace. For example, the younger healthcare professionals that are much more keen on using social networks or, I don't know, online ordering or internet and web browsing as a general are much easier to enter on the platform. But on the other hand, the incentivization program that we have behind as an algorithm in MedRep SaaS is pushing the older healthcare professional towards using MedRep on daily basis. Yes, Mr. Mijatovic, it was hard at the beginning, but from month to month we can see more and more prescription, let's say, generated. From day to day, we can see more and more healthcare professionals logging, first and foremost registering on the MedRep platform Macedonia, because to be able to enter, it's a closed platform, they have to be approved by an administrator that has to check all the data that they provide during the registration process, such as, for example, that they are a licensed healthcare professional. It's a closed platform, that is why it enables the possibility to share those strict and closed medical information. Does this answer your question? Because the answer was quite long. Thank you.
Thank you.
It's a complex environment, it's a complex software, it's a complex issue. That's why the answer is a bit longer.
And hello, how did you resolve the issue with GDPR rules and compliance with the national regulations across the region?
Okay, thank you. I'm laughing because it's the question that the pharma companies are asking from it's the one of the top 3 questions the pharma companies are asking whenever we go. Thank you. So basically we comply with every GDPR regulation that EU has. We have appointed a GDPR officer that complies totally with what we have in Macedonia as a law for information protection and patient information data protection. So basically for Macedonia we are top. Probably there will be some minor things that we will need to implement, but we have a very nice CRM platform that covers all potential flaws or let's say threats that we can encounter on our road. So we have experienced data protection officers that we have hired, and they are just guiding, and we do whatever they ask from us. It's the basic rule. Thank you.
Thank you.
And we are out of time for questions. So thank you, Vladimir. Thank you, jury members.
Likewise. Likewise.